members of the Standing Senate Committee for the opportunity for us to present. So I'm Danielle Lanyi, and I'm the Executive Director for Connexions Resource Center, and our mission is to promote the health, well-being, and vitality of the English-speaking population in the Outaouais region, which is right across the river here, through empowerment, participation, and collaboration. So I will give you a bit of a smaller snapshot than what Jennifer has just provided. So our region covers more than 33,000 square kilometers. We have a population of more than 396,000 people, where English-speaking residents represent 20.7% of the population. We have 4 regional county municipalities, which are rural, as well as the city of Gatineau, where 2/3 of the population reside within the city of Gatineau, and the English-speaking population represents 17.5%. Whereas in the Pontiac area, we have 56% of the population, so our community is very diverse. As well, income is an important health determinant, and although our region does fairly well in terms of income compared to the rest of Quebec, we do have rural MRCs who are deemed as being défavorisés with high levels of poverty and unemployment, and where statistics show that English speakers are even more disadvantaged than their Francophone counterparts. And we can also find pockets of poverty as well within the city of Gatineau and other areas. And so we are still working to dispel the myth that the English-speaking community is wealthy, and to reinforce that language is well researched in terms as a barrier to accessing services. Our proximity to Ontario is also another unique characteristic, where historically English speakers from our region access services in Ontario, and not just Ottawa, but all around, because 1, it was easier to access services in English, and 2, because they had the perception that services were better. However, the impact of that was that their needs were not known by the health institution, nor were they addressed in our region. Subsequently, over time, the situation has changed, where English speakers in the region now want to receive services in their community, in their language. As well, Ontario has now limited access to many of their services in order to meet the needs of their population. Early childhood is a really a near and dear dossier for us. The results of the Enquête québécoise des enfants à la maternelle in 2017 provided valuable insights into the development of children aged 0 to 5. In the Outaouais, there is a higher proportion of English-speaking children who are more vulnerable than French-speaking children in the areas of physical health and well-being, 23.5% compared to 12.6%, as well as communication skills and general knowledge, 25.8% compared to 21%. Clearly, additional resources are needed to better understand and address these disparities. Other vulnerable populations, such as seniors, LGBTQ community, persons with mental health, addictions, special needs, all face important barriers when it comes to accessing basic information on existing services and navigating a complex health system in another language. Connexions plays a vital role in supporting the development and adaptation of services in English in our region through its participation on the Regional Access Committee. In Quebec, as you know, the Act Respecting Health and Social Services states that English-speaking persons are entitled to receive English health and social services in keeping with the organizational structure and human, material, and financial resources of the institutions providing such services, and to the extent provided by an access program. Despite this guarantee in the law, there remain significant challenges in terms of accessing services. To begin with, the lack of bilingual personnel, which is accentuated in our region due to our proximity to Ontario, where salaries are higher, and there is a demand for bilingual personnel. And if you don't have the staff to deliver the services, then you don't have a service. The lack of awareness of access programs within health institutions results in staff being unaware of their legal obligation and responsibility to provide services in English. As well, the institution's capacity to hire bilingual professionals or staff is becoming increasingly difficult to justify, especially in the current political context. In our region, each bilingual position that's posted undergoes close scrutiny and justification, and often results in grievances by the unions. And this even applies in institutions that are designated bilingual. Access programs also do not extend to services such as ambulances, groupe de médecine familiale, private clinics, palliative care homes, or service agreements that the institution has with community organizations for services. The reform of the healthcare system in Quebec in 2015 led to the abolishment of the regional and provincial access committees for 4 years and impeded the adoption of the 2015 and 2018 access programs. We have been waiting since 2020 for the new access programs to be adopted by the government of Quebec. In addition, this reform significantly reduced the number of boards, of health boards, which makes it even more difficult to have a voice as a minority community. Currently, we are looking at another major reform in the healthcare system, which obviously we will be monitoring closely, but in our experience, with each reform in the healthcare system, there has been some type of erosion in terms of access to services in our language, and also in terms of our ability to be able to participate within the health system.
Conclude, Ms. Lanyi, and
I will conclude
okay.
very quickly with just 2 points. One is that language needs to be a health determinant. It needs to be officially recognized. We do not track statistics or the utilization of services, so how can we know what services they are accessing or receiving services in? And secondly, in terms of resources for our organizations, where we really need to have stability and sustainability given the complex system that we work in and the emerging priorities and needs. Thank you very much.
Thank you very much, Madame Lanyi. Ms. Callender, the floor is yours.
Thank you. Good evening. Thank you, Mr. Committee Chair and committee members, for the opportunity to weigh in on this important issue. My name is Tanya Callender, and I'm